Hey there and welcome. My name is Jessie. I'm the founder and one of the cool sculpting providers at Element Body Lab, the Dallas cool sculpting experts. We're talking about cool sculpting specifically for inner thighs, and I wanted to answer all of the questions that usually come up whenever someone is doing some research around treating their thighs. So let's just dive right in and start chatting about, does it work for the thighs? And the answer to that is yes. Cool sculpting actually works on a few different areas whenever it comes to treating unwanted fat on the legs. You can target both the inner and the outer thighs, the space right above the knee, that's called the distal thigh, as well as underneath the butt, which is called the banana roll. And the way cool sculpting works and how we target the pockets of fat is it uses controlled cooling. So if you imagine you've got that stubborn pocket of fat, whether it is a bulge on the outer thigh or a pocket that's kind of chafing on the inner thigh, we draw those pockets of fat into cooling hand pieces. So they almost look like elongated ice cream scoops. But what happens inside of those cooling cups is we administer really specific controlled cooling, which essentially just freezes the fat cells inside of the cup. The change in texture then triggers an inflammatory response where your white blood cells, which are called macrophages, come along and digest that frozen fat, and your body naturally eliminates it through the lymphatic system. What that translates to is about 20 to 25% less fat in the treated area over the course of about 3 weeks to 3 months, depending on your metabolism and your lymphatic flush. So whenever you're thinking about that, most clients, whenever they're looking for results, they're looking for a greater reduction than 20 to 25%. So let's talk about some before and after photos. Let's actually show you some of the inner thigh cool sculpting before and after photos before we dive into some of the other areas. So the pocket on the inner thigh is what you're looking at here. This client came in and she was healthy, maintaining a diet and exercise program, but she just had that stubborn pocket of fat on the inner thigh that she didn't love, that wasn't responding to diet and exercise. So what happened was she had one hand piece like this placed on either side of the leg. So either leg along the inseam of the jean, and you're noticing a very, very dramatic result after just one session. And other clients have a more subtle response because they only have one round of treatment. So this client, same idea, happy with her overall weight and shape. She just wanted a little more slimming through the inseam of the leg. And this client had a completely different shape. She really felt like she had this fullness up through the top of the leg. And you can see a pretty dramatic result here. This is 2 rounds of treatment. And sometimes clients want to treat the outer thigh. So sometimes it's not the inner thigh that is an issue whenever it comes to pursuing cool sculpting. So this client wanted that bulge right at the widest part of the hip to be a little softer, to where she had a little bit more of a subtle curve instead of just a stark bulge. And so whenever you're looking at an outer thigh, what you're looking at is this part that's circled right here. In order to be deemed a really appropriate candidate, in order for a cool sculpting provider to get excited about your treatment, or a medical professional to say, hey, this is a good idea, we really are looking for a distinct peak. So an actual kind of an actual peak on the outer thigh. You don't just want a full leg, you want an actual peak, because otherwise you run the risk of leaving an indentation. So make sure whenever you're looking for a cool sculpting provider that you find somebody who will say no to you, because if you don't have that true peak, you don't want to run the risk of unnatural looking results. So we can see this peak from a few different angles though. So sometimes it's not as obvious straight on, but it's really obvious whenever you're seeing yourself either from behind or at an angle. So this is another outer thigh treatment. And then this is both an inner and an outer thigh transformation. I apologize about the difference in underwear here. We've gotten a lot more consistent with our before and after photos and protocols, but little fun fact, this is actually my own transformation. So I had a very aggressive treatment on both my inner and my outer thighs, a series of treatments. So this is not a single session type of a transformation. This was between 3 and 4 treatment days, and we had asymmetrical plans. So essentially treating different sizes of hand pieces to different legs, because I was really asymmetrical before and I wanted this symmetry after. But here I am years later, and those results have maintained. So whenever the question comes up, how long do those results last? I can tell you years and a pregnancy later, and I'm still enjoying my CoolSculpting thigh results. So I would love to talk to you about how much CoolSculpting costs. I would love to answer any questions that you do have around the process. The way CoolSculpting is priced is per applicator or per handpiece. Everybody calls this something different. Some people call it a cycle, some people call it a treatment, some people call it an applicator. But every time we put the equipment on the body, there's a cost associated. So if you think about it like you buy gas by the gallon, you buy CoolSculpting by the applicator or by the cycle. And usually you're looking at about $1,500 per area per session, because if you were putting one handpiece to each leg or one handpiece to each inner thigh, that would be about $1,500. But if you're looking for a more dramatic 360 change, like what you saw with my own before and after photos, that means you're treating a few different places. So maybe you're treating the inner thigh, the outer thigh, and the banana roll underneath the butt. If that's the case, then you're looking at $3,600 per session. Then the question usually comes up, how many sessions are you going to need? And the only way for us to answer that question is to do a consultation with you. It depends on where you are and where you want to go and how aggressive that result is. If you're looking for more than a 20% reduction, you're likely looking for more than one session or one treatment day. But we'd be happy to guide you on that journey. We'd be happy to give you our insight and our expertise. Because just like I was saying, it depends upon the amount of hand pieces. It depends upon the amount of time and resources needed for treatment. And then, walking into what does that look like then? What do you expect on treatment day? How long are you going to be there? All of that also depends on how many applicators we're using on treatment day. So what you can see here is this is an abdomen treatment, but it's a little easier to photograph than an inner thigh. So what happens on treatment day is we actually have you come to the office, you'll sign some consent forms and knock out some just paperwork for us. We'll put markings all over your body or all over the area that we are intending to treat. Those markings are with Sharpie, just as an FYI. We need to mark the area with a permanent marker so we can actually see the treatment throughout the entirety of your treatment session. Rubbing alcohol will take that right off. We're happy to take the markings off before you leave. Then we place a gel pad down. So the sticky gel pad is a protective barrier. Then we use these suction hand pieces. You can see the hand piece right there, gel pad going on. You can see the hand piece over on the love handle over there. The applicators vary in size and shape. So whenever you're thinking about what type of equipment do we have, the applicators are going to vary in size and shape, but our providers are going to make sure that we use the exact right size. It's kind of like a Goldilocks thing. Can't be too big, can't be too small, got to be the exact right size. We place those applicators, support them with some straps, actually build up some pillows underneath, which will decrease the likelihood of bruising to make you nice and comfortable. Then the treatment takes about 35 minutes. After we take that handpiece off, I'd expect some redness, swelling, bruising, numbness. We actually have a full patient safety data sheet, which includes all the risks and side effects, but you can see the most common one is going to be that redness or that bruising. This is an upper arm that was treated. You can see that bruising goes away after about a week. And then you can expect to enjoy those results somewhere between 3 weeks and 3 months later. Plan for a timeline of 3 to 4 months before you have full results. So if you're looking for a quick fix for a vacation you've got this weekend, CoolSculpting's not the best choice. We would love to plan your second session or any repeat sculpting after about 6 to 8 weeks. I am more conservative with my own treatments. I prefer that 8-week timeline, especially on the inner and the outer thighs. If you're looking at CoolSculpting on the thighs, you want to make sure that you have enough of a timeline because you don't want to be too aggressive with those places that are a straight line. And then finally, I would be remiss to not talk about CoolSculpting for cellulite, because this is a question that comes up a lot whenever someone's doing some research on CoolSculpting on the thighs. And in order to understand if CoolSculpting works on cellulite, you have to understand what cellulite is. I pulled this photo from the Mayo Clinic just to be able to show you a visual. Cellulite has to do both with the fat tissue, which is what you're seeing here, the yellow bit, but more importantly with the fibrous cords, those little white tendrils that are coming down from the skin to the muscle underneath. The only way to get rid of cellulite is to break those fibrous cords, which CoolSculpting does not do. So if you're pursuing CoolSculpting for cellulite, it is not the best choice because it may help make the cellulite not look as intense, but it could make the cellulite look worse depending on the integrity of the skin. There are procedures that are specifically designed to address cellulite, and CoolSculpting is not one of them. So that is my best advice there. Now, as far as just safety information, I want to point you to our website, elementbodylab.com or coolsculpting.com, to do some research over the risks and side effects. This video is meant to be educational and should not be mistaken for medical advice. You will need a medical evaluation prior to a CoolSculpting treatment here at Element Body Lab in Dallas, Texas, but all of that is part of a consultation journey with us here. We offer online booking. You can schedule either an in-person or a virtual consultation with our team. We are a CoolSculpting dedicated business in Dallas, Texas, and we would be honored to serve in your CoolSculpting journey. If you're looking for a provider somewhere besides Dallas, Texas, check out the CoolSculpting.com Find a Provider tool. We'll make sure it's linked wherever you're watching this video. Thanks again for joining us. I hope this was helpful as you are thinking about CoolSculpting on the thighs, whether that's inner thighs, outer thighs, the place beneath the butt, or even the distal thigh. The banana roll and the distal thigh are places that we don't treat as often here because a lot of times they're structural or have to do with skin integrity. But if you do want our advice on those areas, we are happy to provide some insight. Thanks again for joining, and we look forward to seeing you in your consultation very soon.